married couple. I don't do any surgery, but I certainly have everyone on speed dial. I think you look at the patient, there's patients that absolutely need a facelift. I do think that lasers can, after a patient has a facelift, hold off maybe a second procedure or help with that. I also think that you can do a preventative aging, so maybe you would need surgery later. But I think upper blephs and facelifts, I can't do those. I send out a lot of those, and I have 40 devices, so I can do pretty much everything I can with the lasers.
And I think it's important, the surgical, your surgical world, you have documentation. Again, going back to the evidence-based stuff, you have documentation. Hey, facelift works. In 10, 15 years, you may need to do something else or whatever. But in the fractional world, we don't have it yet. So I'm actually in the process of finishing a very large case series with one of my plastic surgical colleagues in China on 5-year results from ablative fractional CO2. And it's probably the largest series that's ever gotten to 5 years. So we hope to have that in maybe David's journal soon.
David.
So I think, irrespective of what is superior, the marketplace has told us that the non-surgical techniques are what people want. And we talked about technologies that don't work and do disappear with time. And obviously plenty of these technologies do work and have stayed. And, I think you just look at this meeting, the number of dermatologists who now come to this meeting versus the number who came 5, 10 years ago. There is a huge role for these non-invasive technologies, even if they didn't work anywhere near as well as the surgical techniques.
Jason?
So, look back. Let's ask another question. Okay, what's better, fat grafting or facelifting? They do different things. So, my favorite facial case will be facelift for excision of excess skin and repositioning, fat grafting for volume, and laser resurfacing for the things that laser resurfacing does. But in terms of our practices, I think actually what I've done is pushed out some things. So facelifts are perhaps at a slightly older age than they might have been. We don't do facelifts on 40-year-olds like they did probably in the past. We'll probably do Ulthera first on someone who comes in their 40s, and maybe somebody with a little neck laxity will then do some either thermy or something else to the neck, and then we'll do a facelift on an older patient. So everything's very complementary in our practice, and we have lots of options. And again, I agree with everyone here that the non-surgical things are getting better and better and better, but they're not replacing surgical options for the older patient.